name's John Medley, and I live in Edmonds, Washington, and I've lived here for 30 years. I worked for Burlington Northern Santa Fe Railroad for 40 years. 32 of those years I was a railroad conductor, working on the freight trains. When I was working as a train conductor, I spent a lot of time sitting as we were traveling between different locations that we had to work at. And I realized that I was having some problems, and I went to see Dr. Grier.
So initially men are placed on medications to see if that improves their BPH symptoms. And medications have kind of universal side effects of nasal congestion, sometimes dizziness, lightheadedness, and ejaculatory dysfunction. So there's some sexual side effects that the medications cause.
And he put me on some medication, and it helped with the symptoms, but over the years, it ceased to be as effective as it once was.
Well, one of the common questions I get from men is they think that if they have BPH symptoms, the only thing that's available is a surgery, and the surgery is going to affect their erections, the surgery is going to affect their sexual function, and it's going to be painful. So if they can get past the fact that we have first medications, where the medications don't work, or now with UroLift, where they can have a very relatively simple procedure and have a prediction of a good outcome and back to the normal lifestyle.
As it ended up, I was the very first patient in the Pacific Northwest to have received this procedure, and I was also the very first for Dr. Grier.
So the way UroLift procedure is performed is the patient comes in, we usually give them a sedative medication before, and then they have a cystoscopic procedure after numbing the urethra and the bladder. But the entire process takes about 45 minutes to an hour.
The recovery time, the recovery itself was not what I expected. It was far better than that. And in fact, 2 weeks after having the procedure done, I was able to travel to Colorado.
So I've been very excited to add UroLift as a new procedure in my practice, because I do think it's a game changer, and it's the first new technique for BPH treatment in the last 10 years that has a positive outcome with very little downside potential.
One of the greatest improvements has been that I can go shopping, and I don't have to, once again, seek out the bathroom when I get to the location where I'm going to shop, or have to use the bathroom before I leave. And so it's just not a constant search anymore to find that relief.
So what I really like about the UroLift procedure is, as opposed to a TURP, the surgery, is this doesn't remove any tissue, there's no heating energy that's used, you don't have to have a catheter in most circumstances, and you can expect a very rapid recovery and back to normal activity within usually 2 to 3 days.
BPH is not a pleasant experience for men. This has been a great experience for me, and I would recommend the UroLift for men.